Thanks a lot to all the panelists who have joined. In fact, we have a very important panel discussion. This is one of the important panel discussion. In the second edition of Healthcare Transformation Summit, since morning we had been talking about various important topics. Once we had this CIO panel where they had spoken about EHR. Just now we concluded about the health tech investments with the CEOs. And here I see this panel as very unique panel from different backgrounds. Though we have two IT specialists, one founder and one doctor and one COO joined us. So I'll quickly introduce the panel. Mr. Kishore Gojia, Head IT CIMS Hospital Private Limited. Thanks for joining in. Mr. Saji Matthew, Chief of HR and IT, Baby Memorial Hospital Limited. Thanks, Mr. Matthew, for joining in. Dr. Suri Raju V, MD and CEO, Regal Hospital. Dr. Suri Raju, thanks for joining in. And Mr. Balihar Virk, Head of IT, SPS Hospital. Thanks for joining in. And Mr. Anurag Kashyap, Founder, MedInfo Menor. Thanks a lot for joining in. And we are here to talk about data. The healthcare beyond data, beyond 20, the decade of data. As we all know, when digitization is the new normal, we are all into the actually drowning in the deluge of data, especially the healthcare. So I just wanted to, start with asking Mrs. Saji Matthew your opening remarks about how different is healthcare data when it compared to other industries. How do you see this? If you can just start.
Yeah. Good evening to all of you, and thank you for having me with you this evening. And thank you for thank you for inviting me to this panel discussion. Talking about the uniqueness and the diversity of data, I would say healthcare data is very much diverse in nature. In the sense, it includes individual health records, that is the vitals, the biomedical signals, the lab results, the biomedical images, genomic data. Then in a hospital or in a healthcare setting, the transaction data that is related to various orders, payments, the various interactions between the patients and the provider. And even to the extent that it includes the medical literature. And also even the data these days from the social media. So it is very much diverse in nature. That is the uniqueness of healthcare data. And also it qualifies for all the attributes of big data in terms of the volume. It is very voluminous in nature, and the velocity, the speed at which things change, the variety of data, and the veracity. Some of the studies shown that way back in 1950, it takes around 50 years to double the medical knowledge. Then in over 1980, it was 7 years. In 2010, it is 3.5 years. In 2020, in 73 days, the medical knowledge doubles. So that is the uniqueness, and that's the nature of medical data.
Okay. To carry on with the same question, Dr. Suri Raju, your thoughts, because you're actually a surgeon basically, and you lead the hospital. So why healthcare data is unique and difficult to measure? You have to unmute yourself. Yeah.
Good evening, everyone.
Good evening.
I am Dr. Suri Raju, urologist. I am heading Regal Hospital. I am a kidney transplant surgeon, and basically I am a clinician. When today, as a clinician, what are all the problems we come across, as well as what is the importance of healthcare data? Based on that, I thought I will share my ideas. As Madam asked, healthcare data is definitely very, very unique, and it is heterogeneous. Each patient is different. Why? Because each patient is different and may interact differently with various physiological monitors and lab tests. various hospitals and healthcare facilities may use different tools and different integration system to store and measure data. Not only that, in each hospital, it has to be integrated in multiple places like radiology department, pharmacology department. So not only that, the treatment wise, some treatment has got structured protocols. Some patients and some diagnosis, some people will have unstructured treatment. So those things has to be changed and adopted in healthcare system. That is why I feel it is one of the unique thing and very difficult to measure.
Okay. So, the same question I would like to ask Mr. Kishore Gojia, like, how do you see the healthcare data, how it is difficult to measure, like, unlike the other industries?
First of all, good evening all. Thank you, Pratibhaji, to inviting me in this forum, and it's a pleasure to have with you all guys. So, as my all the panelists has rightly said that healthcare is a very unique in terms of to capturing the data because different patients have a different treatment, different healthcare service providers have a different protocol. So by itself, data definition is different than the each and every areas. Like if we said state-wise protocol are different, the accreditation body are itself is suggesting a different protocol of data set. So data is very unique in terms of to storing the data. Another thing is that healthcare service provider are using a multiple tools. Let's assume, example, radiology is storing the data in PECs and RIAs. Maybe OPD data stored in EMR format or in digital format. Maybe some few IPD data, unstructured data, which is laid on a paper-based system. So the all the data set are stored on a different platform, and by definition they are different. So the data is very unique. It is very critical to compile on a single stage. It is very collectively difficult to set the data and create a single data policy which applicable across the healthcare. So that is the unique strength of the data, because many of the healthcare service provider are adopting a research model. Many of the service provider are adopting the different accreditation model, and considering that the private and public both the sector have a different practices. So considering this all aspect, the healthcare data especially is very unique and challenging to build a single platform for the same. Thank you.
Okay, thanks. Now I would like to get on to the same questions, comments from Mr. Palihar with, like, what are your thoughts, sir, on healthcare data, and if you can just elaborate.
Thank you very much for letting me part of this August panel. So yeah, as the previous speakers have said, healthcare data is definitely a very unique and I would say yes, difficult to measure also and manage also, because there's some structured data, there is some unstructured data, because there are images. There are packs, there are data in forms of, say, waveforms. Some data may be in DICOM images, some data will be, numerical format, some simple images. So this data, and plus it has to keep connected with the each episode of the patient. It's not like if a patient has come once to the hospital and he comes as a second episode to the hospital, there has to be interconnectivity between the two, because of course the doctors have to refer to the previous his health records, his maybe lab reports, maybe he has to seek the PACS reports, etc. So yes, it's challenging, but on this fronts, HIS vendors and all our application providers, they have been working hard, really hard, to provide the best possible solutions within the framework of the this thing of hospital. And plus we have to keep the data for as per our statutory requirement. Also for MLC patients we have to keep till the almost for the lifetime of the patient. And so these are the reasons that I say that this data is definitely unique and kind of difficult to measure. It's measurable, but it is getting challenging and to measure this thing. Thank you.
Thank you. Mr. Anurag, if you can just share your thoughts, like you're the founder of MedInfo, or if you can just give us a detailed account of like how robust is healthcare data and how difficult it is to, measure it, and there are different segments to it. If you could just add on. Mr. Anurag, if you can unmute yourself, please. Can you unmute, please?
To express my thought on this topic. Yeah, to express my thought on this topic. So, not Pratibha, I believe not, and it require unique skill sets and unique solutions to run it on day-to-day basis. And healthcare leaders, as we have healthcare leaders here, they have developed an ability over a period of time to take decision in uncertain environment. And that and now I'm coming to your topic, the healthcare, why did healthcare data is unique. So this data is basically complex set of structure. The person who is not from a medical background and not a medical practitioner cannot even understand this data. It is a qualitative data. It is not merely a number. There is a hidden description behind those numbers, and those descriptions are capable of being interpreted in a different way. And also this data is diversified. It spread it across all these specialties with wide range of geographical coverage. And and if we compare a particular disease in a particular age group in one state with another state, we'll find the different results. So it's also a huge in quantity. And not only this, lot of intra and inter industries of healthcare are dependent on this medical data, like medical equipment industries. Then we have instrument and pharmaceutical research and development. Then the automation, AI and machine learning, and all these industries are dependent on this data. And this data is also used by the third party paying agencies. This is very a unique combination, as it is unique in a healthcare collects data from a patient and creates more healthcare data and then pass on to the third party make payment to the hospital relying upon those data. And here you would see there are two agencies working on behalf of the patient. One is hospital who is collecting data, and the another one is the third party paying agency who is paying on behalf of the patient. And the next point why this data is complex is this is used for when we use this data for statutory compliances, then this data is used for healthcare welfare schemes, government welfare schemes, where to government should set up a hospital and where should not. So that's why this data is very unique and very different from any other industry or industrial data. And the next part of your question is why it is difficult to measure. This is actually difficult to measure because healthcare has different set of disciplines, uh, uh, as suggested by our panelist also. The healthcare uh, different disciplines have different set of standards and may approach the same problem in a different way. So and it also a variable in consistency. This is highly variable because it reveals different findings depending upon who collected it. So these are the things which makes the data difficult to measure. And one more point is it is not uniformity. There is no uniformity in the healthcare data as of now. The uniformity in terms of collecting, creating, presenting, and supplying should be there to make it easy to measure.
Okay. Yeah. Going on, we had seen like how L data is complex. So I will also come back to this point later. Now we are all have been facing this pandemic for the past 6 months, and we have now like actually used to it. So, but the impact of COVID-19 in healthcare data is really important because now we had not segregated data as all the panelists had informed me. There was like a lot of issues. We don't have a proper segmentization of communicable diseases, non-communicable diseases data. So the impact of COVID-19, how it has brought in the data, healthcare data, significance of it, and how important it is. Mrs. Saji, if you can go ahead and help me with your comments. Please unmute yourself.
So as we all know, coronavirus has brought the humankind to its knees, and so the world has been turned upside down, and we know it is not going to be the same old system or the same way we are going to work on that. So it has called on, or it has uh, urge for new innovations to happen. Thousands of innovations are happening across the globe. So if you look at for all these innovations to happen, for the kind of analytical or AI driven or machine learning driven things to happen, so the data is foremost important. And also the COVID, the corona situation has turned the hospitals into telemedicine and remote care. For the remote care to happen for the provider as well as for the patient, if you have access to digital data, that will make it easy. So now we have come to the conclusion, we have realized that when to understand my patient, to understand their attributes, their needs, I need data. To measure the effectiveness of my treatment, which I am providing to my customers, I need data. I need the data. I need data to measure it. I need data to present to them the various treatment options and the effectiveness of the treatment that is leading to value-based care. So I need data to prove the efficiency and effectiveness of my operations within the hospital, whether I wanted to choose the in-hospital based treatment and whether I wanted to reach out to the patient and provide care at the convenience of their home. And as you know, like with the advances in computing technology and as the machines gaining cognitive capabilities comparable with human beings, it is now become easy for the machines to capture this data using computer vision and using the audio, I mean the uh, voice to text technology or any other such technologies. And with the natural language and processing capabilities of the machines, it is easy to capture and it is easy to share and communicate back to our customers. So this has brought in and this has highlighted the significance or the importance of data in healthcare. So that's the COVID situation. So in the absence of COVID situation, the adoption was a challenge. Now you know, like industries which were like early adopters of digital technologies and heavily data dependent, they were much resilient to the COVID crisis. For example, IT as a whole is least impacted. The banking sector, which is these days heavily technology dependent, they were least impacted. The healthcare, we were traditionally very much on paper and a brick and mortar model where we were heavily impacted, but the COVID had I mean, it's taken us to the next level, helping us to enhance ourselves to provide better care leveraging digital technologies. That's so all of us, right from the top consultant level to the junior most worker in the hospital, all of us have realized the importance of data, capturing the data on a timely basis, using that data to gain meaningful insight to drive the business forward. Thank
Okay.
you.
Yeah. To carry forward the same question, I would like to put on to Mr. Palihar. What is your thoughts on COVID-19 and the informatic now on the data side? Like how important and significance it has brought in this pandemic has brought?
Yeah, this COVID-19 has done or it achieved from the hospital IT departments what the top management was not able to achieve since a long time. It has forced all the users to move towards the digitization, move towards the paperless records. So, in this COVID-19 has really reduced the learning curves for the IT department. They have reduced the learning curves of the different stakeholders like consultants, like other care providers. In fact, very senior consultants who are very adverse to even touching the computers are now very much comfortable, putting the orders on the system instead of uh, going to the COVID area and putting the orders on the patient files, which could be suspected to one of the carriers of the virus and all that, just on a lighter term. So, of course, and then because we have seen that almost all the consultants, all the doctors had moved on to online OPDs, video consults. Patients always preferred uh, consulting the doctors online. And one good thing this COVID situation has even taught the patients and even the doctors that for every small condition they need not come to the hospital. A lot many things could be managed online also. So this is a kind of another aspect of positive or negative, whatever you may say. So this has really forced the all the stakeholders, from the patient to the doctors to the management. Yes, even management was not adverse to making the what you say budgetary this thing on the IT systems wherever it was required, that for say for online platform we require some investment. They were very open to that because that was the only way out. There was no other option. There was no other option possible. So this has really reduced the learning curve for everybody, from top management to doctors to other stakeholders, everyone. This is the biggest takeaway from the positive takeaway, I would rather say, from this COVID-19. Of course, on the whole front, it is a bad for the humankind, but this is the positive thing that I could talk about.
Yeah, finding positive things from a pandemic is nice. So, I would like to post the same question to Dr. Suri Raju. How do you see, sir? Because you'll be meeting a lot of patients day in and day out during this pandemic, and you must be knowing how important it is to have a data on the informatic, like anything like COVID, or such diseases, such pandemics. So we need to have a clear cut data so that at least in the future we can have solutions easier rather than struggling. So Dr. Siriraju, please unmute yourselves, Dr. Siriraju.
Yeah, sorry. The management of healthcare system has totally changed after COVID-19. It can be classified, or in simple words, we can tell treatment before COVID-19, treatment after COVID-19. The reason is we follow three steps: social distancing and hand hygiene, usage of masks. You know, once this COVID-19 started, most of the people stopped coming to the hospitals. They prefer online consultation and online treatment. Today, as a urologist, I every day around 20 to 25 patients online consultations I do. Yes, you just can't compare with examination in front of you and clinical examination when compared to online or digital consultation. But most of the things can be managed. Many, as one of our panelists has expressed, many things you don't require hospital. You need not come to the hospital and seek treatment. Online consultation, digitalization, is sufficient. So it has totally changed the way we take care of this one. The COVID-19 pandemic has accelerated the adoption of digital pictures and telemedicine tools. In addition, population level analysis of the pandemic has required distillation of data real time. Today, in my hospital, we have cloud physician. In that, patient CT scan, X-ray, which are digitalized, are seen by a doctor who is staying some miles away, and he will diagnose it and giving the treatment. The same treatment is followed by the duty doctor in the hospital who is staying in the ICU. So definitely these things we were not aware before this COVID pandemic. So lot of changes have been done, especially, of course, there are some cases like surgeries. You cannot, you have to come to the hospital, undergo. If patient need ICU care, you need treatment in the hospital. But simple problems like hypertension, diabetes mellitus, and most of the problems they are in our hospital we are managing through telemedication. This is what the COVID pandemic has made the difference. And good data, healthcare data is very, very important. Here, once the data is restored, it is stored for many, many years. That is the advantage. Definitely, it has taught us lot of lessons. In the future, the healthcare management is not going to be the same as before, and probably COVID-19 has initiated the treatment. From now onwards, healthcare total management totally differs. Thank you.
Yeah, very true. A lot of changes in the pandemic has brought in. So I would like to quickly go with the same question to uh, Mr. Anurag. Yeah, can you please
Yeah, yeah. Uh, this is true that COVID has compelled every leader to rethink and go back to the drawing board and make the new policies and make the new things. And healthcare has adopted the digital side of this, and which is actually a good side of the COVID. Now, the healthcare generating more data in a digital form then comes with the responsibility of keeping the data safe and secure. And recently, on 22nd of October only, there is a cyber attack on a healthcare player, and lot of data has been compromised. Uh, so we should not forget, while we are inclined towards the technology, it's good we are going towards that way. We should secure this environment, and the our security system should be updated, and we should see uh, the regular checkups and the regular audits of our security systems. Thank you.
Yeah. Mr. Pojia, your thoughts on the same, please.
Uh, yes. So I use one phrase to highlight this situation. Necessity is mother of innovation. So the COVID pandemic is the opportunity for the IT to adopt the innovative ideas and to implement the new things in healthcare. So I'll connect you with the practical example. In the first phase of COVID, we have a one challenge that government has guided protocol to screen all these patient, relative, visitors, and staff, those who are coming in your hospital. So the protocol guided by government was compulsorily follow on paper because they have some questionnaire, predefined questionnaire. The gatekeeper and security has to ask the thing, and they have to define, they have to sign, and then they are able to come to inside the hospital. Why? Because tracking is most important. If we have any suspicious person within our premises, we have to track it, and we have to side by side inform to government. So we as a SIMS, we come up a solution within 3 days of time. The entire screening protocol connecting to flu corner OPD and all will be an online solution wherein each and every visitor come with the mobile device, they scan the barcode, they fill up the protocol questionnaire, and the temperature will automatically taken care. It's give a next alert to next team. If the person have a symptomatic situation, team will be immediately next team will be triggered, and the team will be go and reach to contact to that particular person. So that is the necessary, and based on that situation, IT got a freedom. IT have a chance to explain to management that we can do this much of things in our organization. Only thing is that you have to adopt the technology, and you won't believe most of the doctors, especially those who are not inclined into adopting digital technology, they accept it. And they raise the requirement. They want online patient data on their laptop, on their mobile. Why? Because they are doing teleconsultation.
Mr.
So they
Gopi,
are,
sorry to interrupt.
yes,
Yeah.
yes.
No, I just wanted Mr. Suryaji to mute. Yeah, it's okay. Fine. Please carry on.
Yeah. So they doctor want their data on their laptop, and they got the importance of digital data. Why? Because they don't want to touch the file. They don't want, in OPD also, in today itself, patient are coming physically, but doctor have a preference that whatever they are carrying data, whatever diagnosis happening with that within the OPD time frame, they want everything on their laptop. Why? Because they want to expose themselves. Also, they want to protect the public environment also. So simultaneously, COVID has teach us so many of lessons and give us an opportunity to IT create digital platform, and especially those who are IT guys are keen to adopt the technology. They have taken so many of advantage. In fact, we have built so many things. Our admission process we have diverted into digital platform. Our online OPD process we have diverted into digital platform. Entire COVID round and doctor note, everything we have diverted into digital platform, and that's happened just because of the situation. So that is a take home message, that situation is giving a opportunity. Only as an healthcare service provider and as an IT service provider, we have to take the advantage of that situation. That's it.
Yeah. Very interesting. So I would like to, now we have spoken about the pandemic, which is we are all like facing. But now I would like to take in this question on data rights, how it should be defined, bearing in mind the patient, not the hospital, as a key focus. The data rights, if you can give your comments, how it should be defined and focused on. Like the National Digital Health Mission is being they have started in the 7 union territories right now. In 5 years, we'll have a good digital robust digital ecosystem. So I would like to know from the experts, like how the data rights should be, how importance is patients, and how secured it should be as we are getting into National Digital Health Mission. Mr. Balihar, your views. I can see him writing a lot of notes.
Of course, this data has to be patient centric only, because if this patient data stay within a hospital, of course it will help or serve the hospital purpose, but on the as a community on the large, or the patient on a large, it will not be, because at the end of the day, patient is the rightful owner of that data. Even though that data has been generated in the hospital, patient has every right to be the owner of that data. So the patient data has to be patient centric only. Plus, not only this, because our government has to come with some kind of, and I believe this thing NDH and all, through NDH and all, they are coming up with this interoperability, this thing standards, so that if a patient has been is having a multiple episodes in a hospital, and if that patient goes to some other hospital and he carries that digital data, that data should be readable, and plus doctors and consultants should be able to make the sense out of that data, so that then only kind of continuity of care of that patient will continue. Otherwise, once again everything will be started from the scratch. But right now what is happening is, if a patient moves from one hospital to another hospital, doctor says ये टेस्ट दोबारा करवा के लाओ, ये हम तो अपने टेस्ट की मानते हैं, to be on the lighter side, right? So this interoperability is a must, right? And then on basis this data, the data analytics should play a big role. Through this data analytics, we should be able to provide clinical pathways to that kind of particular diseases. We should be able to, through analysis, we should be able to put the data in a meaningful way to our clinicians. That, for example, for say in this COVID thing, all these protocols are developed overnight, because doctors started learning from each patient, from one patient to another. This medication really works. This approach towards the patient really works. Yes, they came to know that patient, you have to give the anticoagulants to the patient after a certain days, or after a certain period, or after his or her chest CT is showing this kind of sign. All this has developed over the days, rather, because as I earlier said, that this learning curve has been very steep, very short. So if all this data we are able to put and showcase it to our clinicians, that with this kind of approach, this was the outcome, and with this kind of approach, this was the outcome. So if we are able to put that kind of outcome, show that kind of outcomes to our clinicians, that would be, I think, the real motive, or real right outcome of the digitization, what I believe.
Okay. Carrying on with the same question, Dr. Saji, if you could help us with your comments. Please unmute yourself, Mr. Saji.
As other fellow panelists highlighted, it should be patient-centric. That means the ownership should remain with the patient. So that should belong to the person. But if you see like countries who have advanced in terms of medical care, in terms of researchers, countries like Israel, Taiwan, Singapore, the Scandinavian countries, they have like a right balance between the human rights, the privacy, the data security, and meaningful use of the aggregated data. So what I would suggest is, my point of view, we need to honor the individual's rights in terms of whether they wanted to share the data or not, so that the privacy and the security should be honored, and they should be given the full control. But as what we have envisaged in the National Digital Health Blueprint, there should be some consent mechanism, where when the patient wants to take treatment from one facility to the other, it can be seamlessly interoperability, the data can be exchanged. So for that one, we need to have standardizations, we need to follow common standard in terms of capturing, storing the data, and that can be. And government, if it wants to use such data for the policy making, or for the public spending of the money, there should be provision to wisely use it. And also the anonymous data which has been collected can also be used for research purposes. As we all said, we need a huge amount of data for artificial intelligence or machine learning to make meaningful algorithms which can be used. That will eventually going to benefit the mankind itself. Like what we do in the physical realm, where with the patient consent, a body has been given for anatomy, people voluntarily participate in clinical trial. Similar way, in the digital realm, we should have provisions while we honor the individual's right to keep their data private, or they wanted to share it for the common good. That should be there, but at the same time, we have to strike a balance between the privacy aspect, as the meaningful data can be used for the betterment of the human being. That's my view.
Okay. Thanks a lot. I would like to quickly go to Dr. Suri Raju with his comments on this. Dr. Suri Raju, how do you see the data secure rights, how it should be well defined, bearing in mind of the patients as we are heading into national digital mission, a robust digital health ecosystem? Yeah. Please unmute yourself, Dr.
Usually, patients come to the OPD and admission. Patients who have got nowadays they are coming with all kind of investigations showing on the mobile that this digitalization has already in the peak actually. Definitely, once the patient is admitted, his medical records has to be very much safeguarded. There are two, it is a double-edged sword, I can tell you. In case each and every information is given to the patient in the hospital, whatever the treatment is given, sometimes it is going to become legal problem also. For example, a patient underwent some kind of angioplasty. The same, if you give the details to the patient, each and everything, sometimes it may be questioned by someone else and he may go legally. So it is very important which important information should be shared to the patient. Hospital also should keep some important records. When it comes to the legal aspects, then only some of the important information, the data which is kept very, that should be shared. It is not like each and every detail of the patient should not be shared. I have, I know that the patient has right to take all the information in whatever the treatment given in the hospital. There is no doubt at all. But at the same time, some important aspects cannot be shared with the patient also.
True. So, with the same thing, I would like to go to Mr. Gojia on this. Like, Mr. Gojia, what is your thoughts on the data security in patients and yeah,
Uh, I agree with the all the co-panelists because the healthcare facility and the healthcare service provider are collecting the all the details which is relevant for the clinical treatment and all. But we should have to define a protocol. There should be a system and the law for that particular data, that which data and which level we define the access. Of course it should be a patient centric because it is belong from the patient access, and nowadays patient are educated. The more educated patient are demanding more data on their device, because if you come to know, there are so many patient are coming from the village. They know how to use the social media, how to use the WhatsApp and all these things. So they always ask on registration days, do you have a mobile application? Are we getting a data on our mobile? Are we getting a lab result on WhatsApp? So their demand is increased. And considering the demand, the healthcare service provider should have to define a protocol that which data in which form we published and we share with the patient, as well as we can put it for the public access. In terms of, say example, if you are sharing any patient diagnosis detail, so few diagnosis details should not be editable. If patient are receiving editable detail, if by mistake they done and they are forwarding to other consultant or other healthcare service provider, if anything goes wrong, the all three will be in trouble. Those who are giving a treatment, those who had already given a treatment, and those who are taking the treatment. So by law, it is very much, I agree with Dr. Sarjuji that it is mandatory and important. We have to define a limit, we have to define a structure, and data will be always unstructured, so we have to make it structured. Let's example, if you are sharing your lab result with the patient, the HIMS system or the technology which you are using, you guys have, might be we guys have a different technology platform where we have a different data. So while we are specially submitting the data and giving access to the user, it should be in a layman language, like lab parameter with the particular limit and range. So it can be interpreted on a appropriate way, and the other service provider also take the advantage of that particular result. So that is the insight from my side.
Yeah, patient data are really sensitive and we need to be very careful. Yeah, Mr. Anurag Kashyap, your thoughts on this, please.
Yeah. As panelists said, the hospital is only a custodian of this data, and real owner of this data is the patient. And it is very rightly said by Kishorji that we should define a protocol, we should define a strategy and a structure where what should be available to whom should be clearly defined. It can and now since the we are moving towards the digitization, the security aspect is very serious matters nowadays. So the policies which we are making now should be keeping in mind the patient rights, and the security aspects should not be breached. So when we define our internal policies, we should keep few things in mind which actually safeguard the patient's rights. So I would like to discuss few things which we should consider while we collect data from the patient. So we should only collect the necessary information which is useful for the purpose of treatment, and we should avoid taking excess fields from them. And it should be clearly defined in the policy ki what is the time period of this data which is to be kept within the hospital, and after that a discard policy should be set in motion to when the compliance period is over. And even after that the hospital continue to keep that data, then it becomes additional responsibility to take care and to safeguard that data. Even the security, the policies and processes should be clearly communicated, I think should be communicated to the patient even before disclosing the data. And another one is the there should be a mechanism of informing a patient that whose data has been compromised. As of now, there is no such policy that the patient even they are not aware when their data is compromised. So I think this things should be kept in mind while designing a policy or standardizing the procedure. And hospitals should also, I think, come up with the idea where the security policies and security systems and the purpose of the data should be available to the patient, and they should be aware why they are disclosing this data and how it is going to be secured by the patient. Thank you.
Okay. So now we have seen about data security and patient centricity on it. So now I would like to ask the upcoming India's data protection law, which the central government is mulling. So how will it help the healthcare landscape? What kind of things should be like seen in that? It's an overall, data protection law, but in healthcare landscape, what are the things? I think Mr. Anurag had given few pointers. I would like to other panelists also to elaborate on it. Mrs. Saji, if you could just help with your comments. Mrs. Saji.
The upcoming PDP, that is the Personal Data Protection Bill, which is in the Parliament, that is definitely going to help. I mean, ask my fellow panelists, we need to have a legal or regulatory framework in place to ensure that okay, the owner of the data, that is patient, who is sharing this data for a particular purpose. The purpose is to okay get treatment from a hospital or to participate in a certain scheme or anything. So the law is going to clearly mention who is the owner of the data, who is the custodian, the government or the national registries who are going to be the custodian of the data, with whom we can share this data, and in what format. If you wanted to use this large scale data for some research purposes, we need to anonymize, and we can share certain data points which will be helpful in research, how it can be shared, that data, and how long that such data need to be retained. And as already highlighted, if there is a data breach happening, okay, how that data breach, if such a data breach has happened on such and such a patient, how we should inform them, and what is the legal implications on that one. And also, even before we collect the data, there is going to be consents, or we need to inform the patient, okay, this is in whether in our website or in the applications when they come to the hospital, where should be clear declaration on the part of the healthcare provider. These are the data we are going to collect, and we are using this data for this particular purposes. If we share such a data with a third party or with the government without your consent, if need to do, will take your consent. That is what going to be defined in the law. That is in the law which is in the parliament. Definitely that is going to shape the way, and that's going to give a legal framework and much protection which is required. As of now, we are like not sure how we should. A lot of hospitals, especially the corporate hospitals who have adopted EMR for a while, they have all the data. But how we can use that data, if something happens with that data, how that need to be taken care of that one, and what is the legal protection, what's the right of that, which is not clear, as India hasn't signed to any of the international data protection treaty or GDPR kind of treaty. It is not there, but this PDP is going to give us the lever which is required to use the data in a useful manner while protecting the rights of individuals.
Very true. Looking forward for that, data protection law. Mr. Balihar, if you can just add on your points or as well, like how do you see India's data protection law and how it will help the healthcare landscape?
Yeah, as Mr. Shaji Matthews has rightly elaborated, that we have to be, take the consent of the patient when this actually law becomes as a bill, or this bill has been passed as a law. Then definitely we have to, take the consent of the patient, then explain it to him that in what way we are going to use the data, and what exact nature of data are we capturing, how long are we going to keep that data, to which third party are we going to share the data, if we are whether with the name data or anonymously, and if there are any breaches or something like that, what is going to be the step of the data collector, in this case the hospital, and how that loss could be compensated or something like that. So these are the points on which hospitals have to take care of the taking the data protection law into consideration.
Okay. Mr. Kishore, your points on the data protection.
So I must say the data protection law, which is in the process, wherein definitely government will come up with the few unique things which will be beneficial for the patient and the public also. Let's example, nowadays all the healthcare service provider are creating the unique identification for their patient, and the government is come up with a single unique identification which will be unique for across the country. So if patient travel from one state to other state, one service provider to other service provider, the identity will be a unique. So that will be a major benefit to link the patient data and the person history. So let's assume if any person have any comorbidity before 2 years back, and after 2 years he relocate in the other state and he want to continue and he don't have much more enough data, then the other service provider will do some different kind of diagnosis. So the unique identification, data structured, and data policy, and which manner data should be shared, on which level it will be available to the access. These all are the protocol will be a very useful and very important for the patient safety also.
thoughts on the data protection law, the India's data protection law, how it's going to help the healthcare landscape. Now, please unmute yourself, doctor. Doctor, please unmute yourself.
Yeah. India's data protection law will enhance the structure and organization around healthcare data. This will overall be beneficial for the patient care and it will increase the efficiency of the healthcare system. It will formulate prescriptions, diagnostics, and therapies. Accountability and transparency will increase. And the hope is that insurances and third party payers will be able to reward and rapidly transact at their payment to hospitals because of the clarity of the data. So now, as Kishore sir has mentioned, this data protection law is right now they have to take important decision by the government. We are all waiting for that. Thank you.
Mr. Anurag, your points.
Yeah. As of now, the data protection the bill is in the draft stage, as rightly mentioned. It is not yet enacted. But that doesn't mean we don't have any data protection law as of now. The Information Technology Act 2000 uh, provides the data protection laws, and there are this act is basically in line with the international law adopted by the United Nations. So this act was massively amended in 2008 for this purpose only, and there are few very important provisions added for the data protection, which I would like to highlight in this being from a legal background. So I would like to highlight few points here, which I think this platform should know. The yeah, the section 43A of this act clearly puts responsibility on the corporates who are dealing with the personal and sensitive data, and they have responsibility under this section to safeguard all kind of data whether they are collecting or generating, and if they fail on in doing so, they are liable to pay compensation under this section. And another section which supports this section 72A of this act, if there is a voluntary disclosure of this data and in a breach of lawful contract, that will amount to another compensation, and there are provisions of imprisonment as well. Apart from this, there are certain rules and regulations which are created under this act, which is like rule 4 imposes duty on the collector of the data to ensure privacy and security of the data and uh, communicate to the data giver before even disclosing the data. This the privacy policy and the security policy should be available all the time on the website of the data taker, basically the hospitals, healthcare. They should disclose their policy, security policies, and they should also disclose the purpose for which data is being collected, as already suggested by the panelist. And the most important thing is uh, the period for which this data is to be being kept in the hospital, that should be clearly defined in that policy. And in the prior consent of the data giver is also very necessary. And consent is not only the unaware consent. Consent should be aware, and the person should be aware for before disclosing the data, for what purpose he or she is going to disclose his personal information. And he has a right to know when the data is compromised. He has right to know his data is compromised. The most important part of this is the in hospital who is retaining the data beyond the compliance limits is not is actually permissible. They need to discard the data when it is the compliance period is over. So it this policy should also give an option the user to not to give a information. The giver may deny giving the information. That right should be given clearly to the information provider. And if we have time, I would like to talk something the cyber attacks which has recently we have experienced here in the recent study of Cisco says the Indian healthcare has lost 500,000 US dollar in 2016 and 17. And
Yeah. So actually, we have the proximity of time. We are running out of time.
yeah,
I
thank
would
you.
like to, yeah, I had one more question, but I'll not be able to put it across to the panelists. I would like to thank each one of the panelists for their, for your time and availability and coming here to talk about a very interesting topic. This 1 hour is not enough for healthcare data with the country with so much of patients and so many data coming in. So, anyways, I would be like reaching out to you all for the next edition of the summit. I hope each one of you would be joining us in that as well. So I would like to thank each panelist, and we are giving speaker certificates to our panelist, Deepak. Yeah, thanks a lot, Mr. Kishore Gojia, Head ITCS Operations. Yeah, thank. Yeah, the next Deepak. Dr. Suriraju, MD and CEO of Regal Hospital. Thanks a lot, sir, for your inputs. You had given a lot of very good insights. Thank you.
Thank you.
Thank you.
Yeah, one second.
Thank you,
Deepak,
Kritika.
I think there's some technical issue coming. There's a breach or something. We're not able to see the speaker certificates. Deepak, can you please help with the other speaker certificates, please? Yeah, we had actually the next one, please. Thanks a lot, Mr. Parinadvik, head of IT SPS Hospitals. Thanks a lot, sir. Your
Thank
witty
you.
comments were
Thanks a
very
lot.
nice in between. Thank you. And Mr. Anurag Kashyap, founder, MedInfo Minor. Thanks a lot for your participation and detailed
Thank you very much. Thank you.
pointers. Thanks a lot, Mr. Yeah. Yeah, last but not the least, I would like to say thanks to Saji. Mr. Saji has been very, bubbly. He was giving me pointers in, since the beginning when he accepted the invite, and I thanks a lot for that,
Thank you.
push for questions and inputs. Thanks a lot, Mr. Saji.
Thank you so much. Thank you.